My name is Dr. Mark Litso. I am a hematologist in the Division of Hematology in the Department of Internal Medicine at the Mayo Clinic in Rochester, Minnesota. I'm also the co-chair of a national leukemia committee that develops clinical trials for patients who have various types of leukemia. Today I want to tell you some more about acute lymphoblastic leukemia, which we also refer to as ALL. This is one of two types of acute leukemia that can affect patients. The other type is acute myeloid leukemia. Both of these leukemias arise in young cells in the bone marrow. The bone marrow I think of as your blood cell factory. It's located in the middle of your bones and produces red blood cells that carry oxygen, white blood cells that help us fight infection, and platelets that help our blood to clot. When patients develop acute leukemia, such as ALL, some of the young cells or immature cells in the bone marrow are affected. These cells produce more and more of themselves and crowd out the normal cells so that the red blood cells, white blood cells, and platelets cannot be produced. And patients develop low blood counts and become ill as a result of that and seek medical attention. Oftentimes a bone marrow biopsy is done to assess what the diagnosis is and what the degree of involvement of the marrow is. Acute lymphoblastic leukemia is a serious disorder, but fortunately we have effective treatment for many patients with this disease. Treatment of ALL involves chemotherapy, also sometimes radiation. The chemotherapy involves many different chemotherapy drugs that are given in different sequences, and the treatment does go on for many months, eventually resulting in the use of maintenance chemotherapy or pills that can go on for up to 2 to 3 years. But with maintenance chemotherapy, this can be given as an outpatient and affects both children and adults. It's very common in children and is successfully treated in the majority of children. In fact, the treatment of ALL in children has been a great success story for the treatment of cancer and malignancy. Many children are cured. Many adults can also be cured of ALL, but unfortunately the success rates are not quite as high as we see with children. However, we are making a continued progress, and we continue to take many of the lessons that we have learned from our pediatric colleagues who treat the children and are applying these to adults. In particular, the treatment of young adults with ALL has improved significantly in the last few years. We're also developing new treatment modalities, new treatment approaches for ALL, and some of these look very promising. Many of them incorporate the use of what we call monoclonal antibodies. Monoclonal antibodies are proteins that scientists are able to produce in the lab. They're a variation of the natural antibodies that we have in our body that our immune system uses to help us to fight infection. In this case, these antibodies are directed against the cancer cells, the leukemia cells, and can help to kill them. These antibodies are showing promise in the treatment of patients who have their leukemia come back after successful treatment, or if the leukemia is resistant to the chemotherapy that we give. And we are beginning to look at ways that we can apply these antibodies in combination with chemotherapy in the initial treatment of patients with ALL in the hope that we can improve their outcomes. Many of us work at the national level to develop new treatment programs for patients, and we have a number of clinical trials available here at Mayo for the treatment of ALL. At Mayo Clinic, we have the good fortune of having multiple other subspecialists that work in other areas of medicine that we can rely on to help us with the treatment of our patients should they develop complications related to their chemotherapy or antibody treatment. Infection is a significant complication that can occur in the treatment of ALL, and we have infectious disease specialists as one example who are dedicated to the management and treatment of these patients and who assist us greatly in their care. I want to reassure you that if you are dealing with ALL or have a loved one who is dealing with it, that effective treatment is available. Here we have one of the largest transplant centers in the country. We do over 400 transplants a year for leukemia and other related disorders such as lymphoma and myeloma. We have a group of 15 to 20 hematologists that specialize in blood and marrow transplantation and have a large program in this area where we care for patients either in the hospital or oftentimes we can take patients through much of their transplant as an outpatient where they stay here in Rochester, come in every day and are seen and evaluated and carefully managed as they go through the transplant process.